morning, Dr. Dan Anderson, your North Branch area chiropractor. Today we're going to discuss carpal tunnel. I see a lot of patients with carpal tunnel syndrome. We have real good results with that. Today I'm going to talk a little bit about what carpal tunnel is and some home treatment methods, some things you can do on your own. How do you know if you have carpal tunnel? Well, one of the first symptoms you're going to notice is numbness and tingling in your hands, especially at night. You notice it'll wake you up. You feel numbness and tingling, you'll have to shake it. That's usually the first symptoms you'll notice. That's when it's first coming. As it worsens, you'll know it more frequently throughout the day when you're doing activities, and eventually it gets to the point where it's just there all the time. What is it? I mean, how do you get it? Well, commonly done from repetitive activities. A lot of folks, if you're doing construction or if you're doing some kind of repetitive assembly work or hairdresser perhaps, are at higher risk for it because the repetitive use of your hands tightens the muscles in your forearm, which puts more stress on your wrist. And there's a ligament there called the transverse ligament that runs right in your wrist here, and that gets tight, it gets fibrotic scar tissue, and it causes the hole when the nerve comes out, the median nerve, to become smaller and smaller, and eventually that gets compressed, that produces numbness, tingling, and you can produce some weakness, some grip strength weakness too. So some things you can do to prevent it or help treat it if you got it. You can just work on stretching this group of muscles here, these flexor muscles. Just bring your wrist back, hold that for a good 30 seconds. Do it on both sides. Do that, 2 sets of it, 2 or 3 times a day. You can go clockwise 30 times, counterclockwise 30 times. That'll increase blood circulation to the wrist area, help stretch that transverse ligament. You can also just use a little lotion actually on your wrist here, and you just put it right on this transverse area and just do a kind of a self-massage. The transverse ligament runs this way, you want to go this way. And do that, for a good 20 to 30 seconds, a couple times a day too. That'll all help that transverse ligament. Now, if you're successful with that, with these home remedies, great. If that isn't quite enough, it doesn't seem to do it, make an appointment here. We'll be glad to help you. We do a lot more aggressive type treatment of that. We use some more soft tissue treatments. We adjust the wrist, do some acupuncture. It works really well. So anyway, thanks for listening today. Signing off, Dr. Dan Anderson, your North Branch area chiropractor. If you need to make an appointment, just call us at 651-674-8391. Have a good day.